Hey, how's it going? This is Carlos St. Jess, licensed acupuncturist, holistic healthcare provider. How are you doing today? I can speak without my mask on because I'm the only one here today, okay? I can tell I haven't shaven in a while on a couple things. And hey, I call this the pandemic look, right? Just letting it go. Hi, how are you doing today? I just wanted to talk briefly on the lumbar region. And why is this important? There are many Americans, many people worldwide who suffer from back pain. And the statistics that I last had researched show that 4 out of 5 Americans will experience some type of low back pain within their lifetime. So it affects many of us. And what do we think when we have low back pain or pain in that lumbar region? We think, oh, I'm getting old. And so part of my job, part of our duty as acupuncturists and as healthcare providers is to one, help differentiate what's going on with the lumbar region and provide treatment. And in traditional Chinese medicine, lumbar is important because we call it's like your gate of vitality. We say there's certain organs energetically that reside in that region, and there are certain signs and symptoms that will present themselves in the pathology. Uh, Not just in lumbar pain, but in traditional Chinese medicine, right? The weakness in that area will manifest in other areas, right, of the body. And there's a lot of similarities. There could be function. It could be urinary function or bowel movement or anything dealing with the lower extremities. So the lumbar region is an important region because we sit down often, especially in the society. A lot of people are working 40 hours a week, 50 hours a week, sitting at a desk, sitting at home, typing away or whatever you're doing, and putting that compression on the back and those muscles, not only just the lumbar, but the thoracic and all that, but the lumbar takes the brunt of the weight. And so, once again, from the research and just from what I see clinically, the uh, lumbar regions, the vertebral bodies and the vertebrae most affected are L4, L5, S1, and you'll see a lot of whatever they call spondylolisthesis, which is the slipping of the disc, or spondylosis, which is just arthritis or damage, or you might see some desiccation of the disc, or whatever the case may be. Once again, imaging is great, especially as an acupuncturist, as people would think. And I don't want to just say energy medicine and doesn't have any kind of use any kind of contemporary scientific tools, uh, and that's not true. So we do at least I know most practitioners do value that information. I myself, as a practitioner, love that information. It helps us to see what's going on. So then we look at so we have our lumbar. We have this region that can be injured, and it's not just the muscles in the area, and it's not just the vertebrae, right? It can also affect the nerves, and you can have issues once again in the lower extremities, the feet, the thigh, the calf. It can be anything from burning sensations, or it could be pain related, or it can be numbness, or any kind of neuropathy, any kind of nerve damage. So it's important to take a look at what's going on. Uh, it's important to know your anatomy because what we're doing, I say, no matter what's going on, what we want to do is we want to get back to how our body normally operates. And that it helps to know how the body normally operates. That's why you want to know anatomy, physiology, know your traditional Chinese medicine, see where the meridians are blocked, and we ask ourselves the eight questions: yin or yang, hot or cold, interior, exterior, right? And go from there, right? So there's many different avenues we can take in terms of trying to treat and diagnose. But once what I have found, and I enjoy working with first time patients, I enjoy working with patients either to prevent them from having to have any kind of back surgery. Now, a question I receive often is, or you may wonder, can acupuncture help? And my answer with most patients is definitely if timely. Now, some patients are so progressed into their disease that it's just too late for the treatment, and we serve more as an adjunct and help in the recovery, like post surgical recovery. So that's why I encourage patients, and that's why prevention is worth so much more. And if you take care of things early, there is a good possibility you may be able to prevent the surgery, right? Or prevent anything invasive needed. And that's what I'm here for. But it takes patients. You have to take the first step, and we have to educate people in terms of their treatment options, and let individuals know that there are practitioners, providers who are knowledgeable, who are educated, who show empathy, who are professional, and want to help patients. And hopefully, with this video, I can do help be a part of that process and help spread the word and give some information, some knowledge on my end. If you haven't already, please hit the like button. That helps YouTube show this video more so more people can see the video. Otherwise, I think they just hide it in the background or something. So, very much appreciated. You can also visit csjacupuncture.com for more information and to find my clinic location. I'm out in Burbank and city of Burbank and the city of South Pasadena here in California. Thank you very much. Stay safe. I will see you soon.